We have been living with COVID-19 now for many months, and we've been working hard to keep cases as low as possible in Huron and Perth counties. I thank all of you for doing your part. Some of you may have been involved in essential work that continued throughout. Some of you stayed home. Everyone has been practicing physical distancing and careful hand washing and staying home when we are ill, ensuring to be assessed and tested as advised. We've been wearing masks and staying calm and helping our friends and neighbors. Thank you for all the ways you have helped Huron and Perth counties succeed in keeping COVID cases low, in protecting our most vulnerable residents, and in protecting our health system capacity. It has not been easy to live with so much change and uncertainty, and now families with school children are getting ready for return to school. As we prepare, we must remain vigilant in our efforts to keep everyone as safe as possible. School will look and feel a little different this year as we take extra measures to protect against the transmission of COVID-19.
The Avalon-Maitland District School Board, along with the Huron-Perth Catholic District School Board, in conjunction with Huron-Perth Public Health, have developed a multi-layer approach in protecting our students, our teachers and our staff, and our larger community. With schools reopening, we all have a role in continuing to minimize the spread of COVID-19 in Huron and Perth. One of the most important foundational measures to protect everyone is that people who are ill with symptoms that could be due to COVID-19 do not come to school.
Parents, I encourage you to assess your children daily before you send them to school. If they have any symptoms, including fever of 37.8 degrees Celsius or greater, a new or worsening cough, shortness of breath, or difficulty breathing, please do not send them to school. Call your primary care provider and have your child assessed. Your primary care provider may further advise that your child be tested. If you do not have a primary care provider, you may call Huron-Perth Public Health. In all cases, children should not return to school until they are symptom-free or have been advised by their care provider that they may safely return to school in those cases where there are chronic controlled symptoms. A screening card with additional symptoms will be sent home with students in early September. Please arrange for alternate child care plans if your child is too young to stay on their own. This may prove difficult with many parents returning to the workplace. However, we will encourage our many businesses to be tolerant with parental care.
Please also talk with your child about what a school day will look like. Explain that this will be a different school experience than they had before. Assure them that by following the protocols in place, they will be safe. If a student or staff member were to become ill while at school, protocols have been developed for ensuring the health and safety of others.
Many other protocols for students and staff have been developed as well. These include how to enter and exit the building, which bathroom they should use, and also protocols for students who ride the bus.
This video will discuss what schools will look like and what children can expect when they return. It will also outline the many safety protocols in place to ensure the health and safety of everyone. We appreciate your partnership as we all work together to minimize the spread of COVID-19 and make the school a supportive place to learn and grow for all our students.
Thank you for your attention and best wishes as you embark on the 2020-2021 school year.
As we look to reopen our schools, the safety of all of our students and staff is key. The look of a normal school day may have changed, but the emphasis on learning remains the same. Children in grades 4 through 12 must wear non-medical or cloth masks at school. Children in kindergarten to grade 3 are encouraged to wear a mask, but it is not mandatory. Students can wear their own masks, however, a supply of face covering masks will be available to children who have lost or forgotten to bring one. Screening. Parents will be asked to acknowledge that by sending their children to school each day, they have completed a self-assessment of their children. Details will be provided to parents. Any child who exhibits symptoms of COVID-19 must not be sent to school. Children who present signs and symptoms of COVID at school will be removed from their class, and a phone call will be made home for the student to be picked up. Teachers and other school staff will be wearing masks and/or face shields while at school. Some teachers, depending on the circumstance, may have additional PPE. This PPE is to ensure the safety of your child as well as the safety of our staff. Schools will be divided into sections based on their location. These classrooms will share entrances and washrooms. This has been done in order to minimize contacts your child may encounter within the school day. Children will be encouraged to arrive at school as close as possible to their start time. Once at school, children will be encouraged to wear their mask as soon as they are on school property, physically distance while on the schoolyard, and head directly to their designated entrance door. Parents are encouraged to talk with their children about the importance of maintaining distance with children outside their family when walking to and from school. Children will line up with their class while maintaining distance once they have been instructed to enter. Each class will enter the school separately and head directly to their classroom. Children in secondary schools will be encouraged to enter the school using their designated entrance. If secondary students leave during the lunch hour, they will be expected to use this same designated door. All classrooms will have hand sanitizer for children to use upon their entry into the classroom. Some classrooms will have sinks, and children will hand wash before taking their seat. Desks and tables will be arranged within the classroom to minimize the number of direct contacts while trying to support the greatest amount of physical distancing. This may look different for each room depending on the number of students and size of the classroom. In order to ensure proper contact tracing, your child will be assigned a desk by the teacher. Students at the elementary level will remain together with their class for the entire day. Classrooms will be designated to allow for 2 meters of space between the teacher and students to maintain a safe physical distance. This also allows for itinerant teachers to enter the space while remaining distanced from the students. Recesses and lunch breaks will be staggered at the elementary level by the classroom location. This will minimize the contacts students have at recess. Students will be encouraged to wear their masks if they are not involved in active play or if they cannot maintain distancing while socializing at recess time. 1 student per class at a time will be allowed to use the washroom that is designated for their classroom. Washrooms will have capacity limitations posted. All schools will be closed to non-essential visitors. Parents will be encouraged to phone or email into the school office. When picking up your child, you can use the school intercom to communicate with office personnel and arrange for the student to be dismissed pending visual confirmation. Schools without intercoms will post their phone numbers on the front door. Regular cleaning and disinfecting will be completed in high-touch areas a minimum of twice a day. Items such as carpets, plush toys, and dress-up clothing that cannot be easily cleaned or sanitized have been removed from the classroom. Frequently touched items within a class will be minimized. However, students may be asked to sanitize shared items they may come into contact with. Parents are encouraged to reduce the amount of items a child brings to school, and items should be properly labeled with the child's name. We look forward to welcoming our students back to school. These protocols and precautions are being put in place to minimize the risk of the spread of COVID-19. We are in this together, and our parents and caregivers play an important role in our efforts to keep everyone healthy and safe. We'll see you in September.